Welcome to Training 2, FHIR Technologies and Ecosystem with a Public Health Focus. In this session, we move beyond the foundational principles of FHIR and focus on the technologies and architecture that make it work in practice. This includes how data is exchanged using FHIR, the different interaction models it supports, and the ecosystem of tools and standards that enable scalable, secure, and interoperable health information systems. For public health professionals, understanding these concepts is essential for working with technical teams, designing data flows, and evaluating the feasibility of FHIR-enabled solutions. By the end of this session, you'll be able to describe the major FHIR exchange mechanisms, including RESTful APIs, messaging, subscriptions, and document-based exchange. You'll understand the role of Smart on FHIR in enabling secure app integration. We'll also introduce system roles in FHIR architecture, like servers, clients, repositories, and facades, and discuss how they interact in real-world workflows. Finally, we'll explore tools for testing and implementation planning, and outline how public health teams can begin applying FHIR to priority use cases. FHIR supports several types of data exchange, allowing organizations to select the approach that best fits their needs. The most common method is the RESTful API, where a system sends a request to a FHIR server and receives a response containing specific data, such as a patient's lab result or immunization record. Application programming interfaces or APIs are standardized sets of rules that allow software applications to communicate. APIs are everywhere in modern computing. When you use your phone to check the weather or your email app to download messages, you're using an API. In healthcare, APIs allow one system, like a public health database, to ask another system, like an EHR, for specific structured information. FHIR APIs follow the REST architecture, which stands for Representational State Transfer. RESTful APIs use standard web operations such as GET to retrieve data, POST to submit data, PUT or patch to update data, and delete. In this model, a client such as a public health surveillance system or a data integration engine sends a request to a server, usually hosted by a clinical provider or EHR vendor, which responds with the requested data. RESTful exchange is widely used because it is simple, scalable, and follows web standards already familiar to developers. RESTful APIs allow for a client to request or pull data without waiting for data to be pushed. It allows for on-demand data access, which can greatly enhance workflows in public health surveillance, investigations, and follow-up. Another mechanism is FHIR messaging, which resembles traditional HL7v2 message exchange. It is event-driven, meaning messages are sent in response to specific triggers, such as a patient discharge or a new case diagnosis. This model is useful when systems must automatically notify another party when an event occurs. In public health, FHIR messaging might be used to transmit death reporting data from hospitals to vital records offices, ensuring timely updates to mortality registries. FHIR subscriptions provide yet another method. Subscriptions enable one system to subscribe to notifications when data changes or certain events occur in another system's data, such as the creation of a new observation or condition resource. When the specified event happens, the subscriber is notified in real time. This model supports proactive, event-driven workflows. For example, a public health system could receive an alert when a provider records a diagnosis of a reportable disease, allowing immediate case initiation. The last mechanism we'll cover is document-based exchange, which supports the sharing of clinical documents. Although FHIR is primarily structured around granular resources, documents like discharge summaries or case reports can still be exchanged using the document reference resource, allowing hybrid models that incorporate both narrative and structured data. To design or understand a FHIR-enabled system, it helps to know the basic roles systems can play. A FHIR client is an application, tool, or service that initiates the request. In public health, a FHIR client might be a reporting system querying for missing data elements in an electronic laboratory report. Next, we have the FHIR server, which holds the data and responds to API or message requests. A repository stores FHIR data persistently in native FHIR format. It is often built on FHIR server technology and may support both querying and data ingestion. Lastly, a facade is a special component that acts as a translation layer, bridging non-FHIR systems and modern FHIR interfaces. Rather than storing FHIR data natively, it maps requests to underlying systems like HL7v2 or CDA-based environments. This is particularly helpful in public health settings where older systems remain in use. A FHIR facade can enable participation in FHIR-based exchange without requiring full system replacement, providing a transitional path to modernization. Understanding these components, and how they interact, is key to building and supporting scalable public health informatics solutions. Another critical component of the FHIR ecosystem is Smart on FHIR, which stands for Substitutable Medical Applications and Reusable Technologies. SMART provides a framework for securely connecting apps to health data using FHIR APIs. It leverages OAuth 2 for authorization, ensuring that only approved apps and users can access protected health information. In a public health context, SMART enables scenarios such as accessing an EHR-integrated birth certification app, or a screening tool that pulls in clinical data during a provider visit. Because Smart on FHIR apps follow a standardized launch process, they can be embedded directly into provider workflows, reducing friction and improving data accuracy. These apps are not limited to large vendors. Public health agencies, universities, or vendors can develop and deploy smart apps that address community-specific needs. To support exploration and adoption of FHIR, several sandbox environments and tools are available. One example is MELD, an open-source platform developed by the Interoperability Institute. MELD provides synthetic patient data and supports a wide range of FHIR resources and operations. Public health teams can use MELD to test queries, simulate workflows, and evaluate responses in a safe, controlled environment. Another useful tool is Postman, a software platform that allows users to create and test API calls. With Postman, public health analysts can build and test FHIR queries, such as searching for a patient's immunization record or lab result, and view the returned JSON data. These tools help bridge the gap between policy and practice, empowering public health teams to better understand how FHIR interactions work in the real world. Other implementation tools include the FHIR Validator, FHIR IG Publisher, and the Inferno Test Suite, all of which can be used to verify that systems conform to FHIR specifications and implementation guide requirements. Many public health agencies begin their FHIR journey by identifying a priority use case, such as improving completeness of case reports, accessing vaccination history, or exchanging death data with EHRs. Once the use case is defined, the team selects an exchange model like REST, messaging, or subscriptions. The team identifies which FHIR resources are needed and how they map to existing systems. Security and privacy must also be addressed. TLS encryption, OAuth 2 authorization, and scoped access tokens help meet HIPAA and other regulatory requirements. Public health agencies must work closely with their legal, policy, and IT teams to ensure secure implementation. From there, implementation planning includes defining business rules, engaging with technical partners, and testing the system using sandbox tools or pilot environments. Participating in HL7 Connectathons, structured, collaborative testing events, can also provide valuable insight and validation for public health implementations. To conclude, FHIR is not just a technical standard. It is part of a broader ecosystem that includes APIs, apps, IGs, testing tools, and community collaboration. For public health, this ecosystem represents a major opportunity to modernize systems, reduce manual burden, and gain faster, more reliable access to clinical data. We encourage you to explore sandbox environments like MELD, review FHIR implementation guides, and begin conversations with your IT teams and data partners about how FHIR can support your program's goals. In future sessions, we'll look more closely at how these technologies are applied to specific public health use cases, such as case reporting, newborn screening, and outbreak surveillance. Thank you for joining this session on FHIR technologies and ecosystem architecture.